I'm Dr. Rebecca Schulke, and I specialize in treating and reversing neuropathy. And today I wanted to answer the question, how do I know if I have peripheral neuropathy or if I have something else going on like an irritated pinched nerve or a disc bulge or a disc herniation going on. So there's different ways that you can test for this, and there's very different symptoms as well. For example, if you have a pinched nerve, that can be from a disc bulge, it can be from arthritis. This will feel quite different than neuropathy. So first of all, just having nerve pain does not mean that you have neuropathy. They're very different conditions. I'm going to break that down a little bit, but nerve pain will typically, it'll be like a sharp shooting pain. It'll start from your back, travel down the glutes into the back of the leg. Sometimes it goes all the way into the foot. That's more classic with something like sciatica. Or if you have a pinched nerve in your neck, you'll feel the pain travel down to your shoulder, sometimes down into your arm and then into your hand as well. And this is oftentimes confused with something like carpal tunnel syndrome. So these are very different conditions than something like peripheral neuropathy. So if you have a nerve issue, things like chiropractic, doing decompression, some people opt for injections or surgery to help with their nerve pain. That's the avenue you would take for nerve pain. Now, peripheral neuropathy is something very different. Neuropathy is a systemic issue where your body actually attacks your own nerves and your blood vessels, and it causes degeneration of that tissue in your body. And it'll typically start in the feet first, most oftentimes in the toes, and it can be just in 1, 2, or 2 toes. It could be just in the ball of your foot at first. It can start on one side, and then let's say a couple months later, a year later, it could start in the other leg. Sometimes it starts in both legs at the same time, not always, but it'll start with a lot of different symptoms. It can be sharp pain, it could be burning, tingling, it could be just numbness, or you could have both numbness and you can have pain from that as well. With neuropathy, there is a lot of different symptoms that you can experience from that nerve damage that's happening, but it'll typically start in your extremities, far away from your core. That's why it's called peripheral neuropathy, because it starts far away from your core and it works its way up towards the center of your body. Sometimes peripheral neuropathy will start in the hands first. That's not most cases. However, if you have peripheral neuropathy starting in your feet, oftentimes you'll get it in your hands maybe a year or 2 later. It could be 5 years later. But if it does start in the feet, at some point in time, it does typically move to the hands as well. So there's no set symptom that everybody experiences who has neuropathy, right? Pain, tingling, numbness, sharp shooting pain, burning pain. It doesn't have to be constant. It can be off and on, but over time, as it progresses, it does switch to being more constant. Sometimes in the beginning, it's just at night. Sometimes it's just during the day, and then that also becomes more constant as well. But if these symptoms sound like you, the earlier you get it checked out, the easier it is to treat and the easier it is to correct, and the faster that it can get corrected as well. If you think you might have neuropathy, you shouldn't wait. The sooner you get it checked out, the sooner then you can get it diagnosed properly and then treated properly. The faster you can get things treated, the less time it takes and the less expensive it is as well. So I hope that's helpful for you. If you want more information, you can click through to our website and read more about what we can do, read more information on neuropathy and how we can help you. Thanks for watching.